Well, kia ora koutou katoa. No mai haere mai ki te manatu holder. Welcome back to the Ministry of Health. Thank you for coming up the road to the stand-up today. So, today there are 9 new cases of COVID-19 to report, 8 confirmed cases and 1 probable case. One of the confirmed cases is an imported case who was picked up in a managed isolation facility, the 4 Points by Sheraton in Auckland, at routine testing around day 12 of her stay. The person who tested positive is a woman in her 30s, and we don't have information on where she has travelled from and through to get to New Zealand, but we will make that available as soon as possible. It may well be in time for the statement that goes out later. The other 8 cases, 7 confirmed and 1 probable case, are in the community and all are epidemiologically linked to the Auckland cluster. One of these had contact with another confirmed case on a bus. 4 are household contacts of confirmed cases. 1 has had contact with a confirmed case at a church, and 2 are workplace contacts, and one of these is the probable case. And just a reminder, a probable case is someone who has a strong epidemiological link, symptoms that are consistent with COVID-19, but a negative test. And usually in those instances we will be retesting these people. And I should say that a new feature of our management of this outbreak is that we're also testing all people in isolation who have initially been tested. They're also being retested at day 12 just to identify if there are any late asymptomatic infections there. So obviously that has an important bearing on then the period of isolation people are in and or their family members. So these additional cases today bring our total number of confirmed cases to 1,332, and we will report that through to the World Health Organization. Our total number of probable cases is 351, and our combined total of confirmed and probable cases is 1,683. There are 123 active cases at the moment, and 19 of these are imported cases that are in managed isolation facilities. By this morning, our contact tracing team, working with Auckland Regional Public Health, had 2,300 close contacts of the cases we have identified in the community, and 2,249 of those had been contacted and were self-isolating at the time of the reporting at 10 o'clock, and the rest are being contacted. There are 151 people linked to the Auckland cluster that have moved into the Auckland quarantine facility. This includes 82 people who are positive cases and their whānau members. Today we have 10 people in hospital with COVID-19 infection. 3 are in Auckland City Hospital, 4 are in Middlemore, 2 people are in the North Shore Hospital, and 1 person is in Waikato Hospital. The new person in Auckland City Hospital is linked to the community cluster and was transferred there from the quarantine facility late on Sunday. 8 of those in hospital are on a ward and 2 are in intensive care at Middlemore Hospital. As I've said before, our hospitals continue to manage patients with COVID-19 using appropriate infection prevention and control protocols to ensure that those facilities remain safe for both staff and, of course, other patients to use and for visitors. Yesterday, our laboratories completed 4,589 tests, a low number which we do see on a Sunday, and this brings the total number of tests completed to date to 697,070. And in the last 7 days, our labs have processed almost 100,000 tests for COVID-19. I'd like to sincerely again thank not just those carrying out the testing, the swabbing in the community, our excellent laboratory staff, but also all New Zealanders who have come forward to be tested as part of our efforts to find every case we have in the community. And just a reminder, people with symptoms that are consistent with COVID-19 should seek advice from their GP or health line about getting a test. And on to the New Zealand COVID Tracer app. There are now more than 1.77 million people who have registered to use the app, representing around 43% of the adult population that is over age 15. It's very encouraging to see this uptake continue to increase, and it's great that New Zealanders are clearly aware of the importance of keeping a record of their movements to assist our contact tracing efforts. And the recent cases have shown us that the ability to be able to rapidly trace and contact and isolate people who may have been in contact with infected people is key to us stamping out any outbreaks like this that do occur. It's been well over 1 million scans every day in the past 7 days using the app. There are now 313,119 QR codes that have been created, and the number of QR codes being generated each day is starting to tail off over the last 3 days, indicating that it seems almost every New Zealand business or other premise that is required to have a code now has one in place. I'm open to questions.
One Auckland family with the child labelled as a close contact of a positive case at Southern Cross School in Mangere have been waiting 9 days for results. What could cause a delay like this, and is this acceptable enough?
9 days is too long if they haven't indeed been waiting that long for a result. Just to reiterate, any positive results are actually notified automatically from the laboratory to our EpiServe database, which we have access to, as do the Public Health Unit, as does ESR. So those are followed up immediately. But still 9 days is too long for someone to be receiving what will almost certainly will be a negative result. And I can follow that specific case up now that you've brought it to our attention.
Those 2 new cases over the weekend that were under investigation, could you just give us an update please on those 2?
Yes, we had one who's a gentleman who presented at the North Shore Hospital ED overnight on Friday, and that case is still under investigation. That is going to be genomically sequenced today at ESR, so the sample is there. We haven't yet been able to find an epidemiological link with the current outbreak, and so the what they call whole genome sequencing will be helpful in this regard. Of course, that will help us rule in or out whether this case is part of the current outbreak, but we're very keen, of course, in all these cases to establish the epidemiological link, because that helps us identify whether there may be others out there who could be as yet undetected. The other case is an interesting one. This is someone who was detected through follow-up because he was tested. His brother had travelled to Hobbiton and was tested because there was some follow-up of people who had been there. This person is asymptomatic, and all the indications are that this could be an old case. This is someone who arrived in the country in June and didn't return a positive test during their stay in managed isolation and quarantine. And so we're doing further work on that person's case, including also doing, if possible, whole genome sequencing to see whether it's linked to this current outbreak or is potentially a different genome sequence that could help shed light as well onto the current situation.
When you say old case, how far back could that person have had the virus?
Well, it could have been even before they came to New Zealand. So we have had, over the last couple of months, a couple of cases where actually someone has returned a positive test who we knew had been infected, in one case more than 100 days ago. So there are still these viral fragments around. So the person may have been infected prior to coming to New Zealand, and the test at that point during managed isolation, a day 3 and day 12 test didn't pick it up, but it's being picked up now. Or it could have been that the person went right through and the infection wasn't picked up, even though they did have an active infection there. That's less likely.
With the bus trips and the sort of possible spread in that direction, I mean, how confident are you that you've that the perimeter of this cluster has been obtained at this point?
Well, one of the things that is encouraging is that the vast majority of the cases we can quite instantly link to existing cases, so they are known close contacts. But certainly these other cases, including the one on the bus that we're still in there are now 2 linked to that, two linked to the bus, do give us pause for thought, as indeed does the case that presented at North Shore Hospital. So we have, right since the start, had cases where initially we couldn't epidemiologically link them. And in fact, one of our very earliest cases, who was the GP, we have now, through the genome sequencing, linked to the outbreak, but still haven't epidemiologically been able to link that. So it's important that we are confident we've got that that sort of perimeter identified. So there will be ongoing high rates of testing this week, in particular in that Pacific community in South and West Auckland.
Do you
Unlikely,
sort of,
Sorry,
do you
follow.
do sort of rigid measure for how much of a perimeter needs to be, I mean, it's obviously hard to assess, but do you have any sort of rigid measure of that?
Well, not so much a rigid measure, but what will be looking for, and what we are looking for, is to ideally not see cases popping up that we haven't already identified through our contact tracing. So they're already known close contacts or casual contacts of extant cases. So that gives us an idea of how. So it's not so much a geographical perimeter, it's more knowing where all the new cases are coming from. And this was the same when we came down out of the alert levels 4 and 3 and 2. We got to this, in the last outbreak, we got to this point where all new cases were, in a sense, not unexpected. They were linked to existing clusters or existing cases.
In terms of the testing wait times, some of the positive cases, obviously they're contacted immediately. Can you just sort of shine some light on, are you concerned that this gives a false sense of hope to people, potentially if they're waiting 4 or 5 days for a test, they're not contacted immediately, could they still test positive?
It would be unlikely, and 2 comments to make here. First of all our cases or people who are being tested, for example, if they're close contacts, are all in isolation, and they wait in isolation. Now, it would be very unusual, and especially because if the test is on someone who is a close contact, who has got a higher risk of being a positive case, those tests are prioritised, as opposed to those which are just in the general population where there's no known link. So that's the first comment I would make here. Second comment I would make is this is about our contact tracing, and I've mentioned this before. Often when we go back and talk to people a second or third time, we identify other possible close contacts, and then those people are followed up. So there can be a period, ideally we want that period of time from when a case is positive to when we have any close contact isolated and awaiting or having been tested. We want that to be within 48 hours. Sometimes it is longer just because of those additional close contacts are identified as we go along. But the key thing is getting that positive result within 24 hours, and that's our aim with all of those positive results.
Do you know what the average wait time is currently in Auckland for the return of COVID tests compared to the rest of the country?
No, I don't, but what I can say is those lower volumes over the weekend, which we always see, will have given the labs a chance to absolutely catch up, and of course then the reporting through from GPs as well. So the tests take some time to get to the lab, then they're processed, then all checked, then reported to the GP, and then the GP sends the result out to the person who's been tested.
And are Auckland tests and essential worker tests being prioritised at the moment?
Well, certainly all the Auckland tests can now be processed in Auckland, and the labs have got the capacity to do that there. So the tests that are prioritised are those ones that are amongst close contacts in particular, and those ones amongst border and workers, and of course people who are in the managed isolation facilities, so that there's no delay in them being able to leave the facility if that second test is clear.
So
Is it that we'll keep seeing cases stemming from those bus trips, and is that a concern?
Look, the exposure happened probably around 10 days ago now, so there may still be some cases that have come through, and you might have seen yesterday there was some additional bus trips that were also added, so it's good we've been able to use the data from the hop cards to identify other trips that those cases have taken. We may well see additional cases coming through, and obviously the idea is to try and proactively contact people who had been on those buses at the same time as any one of the now 3 cases that have come through from a bus trip. We may well still see further cases. The important thing is, of course, is this is happening in alert level 3 in Auckland, so there's much lower rates of movement. People are not going out and about near as much. And for example, the new case that is from a contact on the bus, that person had been working at home ever since they took that bus trip. And hence the value of that alert level 3 is that people are not out and about doing what they would have been doing.
In terms of tests, we keep hearing about people having quite big delays in getting their test results. Can you tell us how many tests we have in New Zealand?
You mean what's our...
Test kits?
Oh, test kits. We've got a lot of tests. So at the moment, we've got, despite all the testing over the last, say, 10 days, we've still got full test kits for 270,000 tests. We've got hundreds of thousands of swabs, and there are another 200,000 arriving before the end of the week. So there's no shortage of the supplies. Our labs now, prior to this Auckland outbreak, our sort of total lab capacity was around 12 to 13,000 tests a day. They believe that now on any one day, if they need to, they can surge up to around 26,000, and that a sort of steady state they could maintain for a reasonable period would be around 15 to 17,000 tests a day. So our laboratory capacity is good, and obviously we're doing everything we can to try and streamline that process of getting the results back to people as quickly as possible.
What bearing does 8 new community cases have on the decision you make today?
Look, I can't comment on that. I've given my advice to Cabinet, and the Prime Minister will be announcing what Cabinet's decision is at 3 o'clock today. So.
Last time we were at level 2, there was a requirement on businesses to make sure people scanned QR codes or signed in before entering, except for retail businesses. The order that's sort of been amended and come out over the past couple of days makes clear that that's not a requirement in level 2. Businesses have to make that available, a sign-in sheet and a QR code, but they don't have to make sure people scan in. Why that change, and does that mean we're in a weaker level 2 than we were last time?
I think we're in a much stronger level 2 because we've clearly got a great, much greater number of QR posters out there, QR code posters out there. And from what I'm seeing of people, and I think the measures that businesses are taking is they're making it much more routine for people and easier for people when they enter the business to scan. And of course it's a learned behaviour, and we're seeing that by the number of scans. People are just taking that on board as something that you do as you go into a premise. So I think we're in a much better position. I think the obligation on businesses to display the QR code is the fundamental thing here. Then it makes it easy for people to scan.
Is on the sort of border testing issue, the Ministry of Health sort of technical document of the testing plan says that it's not viable to test all asymptomatic border-facing workers. Did the Ministry of Health attempt to implement a plan where all asymptomatic border-facing workers were tested, and if so, why go against the plan?
So at the point the plan was written, if you looked at our laboratory and our testing capacity, our swabbing capacity, we didn't think it was feasible. So the point that was being trying to make was to start with prioritising the groups who were potentially at higher risk of being exposed. So those who were interacting with people coming across the border, in the case of an airport, or potentially exposed to crew in the case of maritime ports. We have seen over the last week and a half, though, that if we stop other activities and surge up that swabbing workforce and the labs, that we can test all of those people. And now we're in the process of finalising a plan for what that ongoing, routine, regular testing might look like. And as part of that, one of the things we are looking at with renewed interest is the accuracy and viability of, for example, using spit or sputum testing, which would obviously, if you were being tested quite regularly, including up to weekly, that would be a far more, I think, a more pleasant and viable option for those workers who did require regular testing.
So was there a change in sort of tack at some point in June or July or August where the Ministry of Health said, actually, we are going to try to roll out testing, asymptomatic testing of all border-facing workers, or did that only happen after this latest outbreak became apparent?
But we were in the process of rolling out regular testing of all border-facing workers. Just reiterating the point that we couldn't test everybody all at once weekly, so we would, and now working with the border agencies to identify who are those who might be at higher risk, who would require more frequent testing, and those at lower risk, and getting that into a regular pattern. And I should say, as I've said before, there are two sides to this coin. One is the availability of the staff to do the testing, and the other is the availability of the workforce to be tested, and a lot of complexity around the latter that is now being worked through.
You spoke about before a stepping stone possibly between level 2 and level 1. What might that look like in terms of mask wearing, crowd numbers, etc.?
I don't have any comment to make on crowd numbers. I guess my comment there was more aimed at thinking about the sorts of behaviours we have reminded ourselves we need to do in Alert Level 2 and certainly in Alert Level 3, and making those routine even when we're in Alert Level 1. The use of the QR code, scanning of the QR code to keep a track of where we've been is a very good example. Much more attention to hand hygiene, physical distancing in certain places, but no work's been done on potentially changing size of mass gatherings and so on, because that's Alert Level 1 is designed to allow us to be confident that we actually don't have the virus circulating in the community. We don't have community outbreaks that are continuing, so that we can be in that sort of much looser arrangement, but just making sure we're doing everything we can to help head off, and or if we do get a case again, we can get on top of it very quickly.
What about mask wearing though? Should people be wearing masks at level 1, for example?
Well, I think look for some further announcements from the Prime Minister on that. I think one of the things that will help us get used to using masks in alert level 2 and 3 when we know it's really important if there are outbreaks in the community is just kind of getting used to wearing them in alert level 1. Now, that doesn't mean they need to be worn by everybody everywhere in alert level 1, but just, I guess, that opportunity to normalise their use. There have been some good suggestions put forward in this regard. I think Mask Monday, where we just all mask up for a day, might be a good idea. Maybe not every Monday, but anyway.
Do you have the breakdown of how many tests were processed from MIQ yesterday for the 4,000? And do you have?
No, I don't have that with me, but we can put that in the media statement.
Because yesterday's tests processed were the lowest since before the outbreak. Is that of concern to you?
It's not of concern, actually. I commented to the person who reports this. It's a number that would have delighted us all 2 weeks ago, so how much has changed. It just does reflect that there had been this huge surge of testing early on in the outbreak, and interestingly, I think people tend to not go to be tested on the weekends. Maybe they're enjoying time with their family more. So I'm sure we will still, in fact, we know and we have a plan to get that testing up again over this next week, just to ensure we're helping to define the extent of this outbreak, particularly in Auckland. Any final questions?
Yeah. You've talked about the benefit of level 3 in stopping the spread. How crucial is level 3 while we still identify the perimeter of the cluster and identified cases?
Well, it's certainly been of value to date, and the Prime Minister will have more to say about what happens next at 3 o'clock.
Do you think mask use does need to be made mandatory? Because it does seem to be one of those things that people just aren't going to do if they're not actually kind of made to do it or required to.
Yeah, it's a very active discussion, and again, I think the Prime Minister will have some specific comments on this at 3 o'clock, actually.
Just a few questions from a reporter in Auckland about the St Luke's worker in the bus journey. It appears the worker was identified on August 19, which is a Wednesday, yet it wasn't until the afternoon of Friday the 21st that health officials contacted Auckland Transport regarding the bus journeys. We're wondering why there was a delay there, and would this information not emerge during the first interview on the Wednesday?
It's a very good question, and just to explain, of course, what we're asking people to do is recall a full 14 days, and that first interview happens. The purpose of that first interview is to try and identify all close contacts and make sure those people are then immediately contacted, isolated, and tested. And then it's often either at that interview or a subsequent one where the person's detailed movements over the preceding 14 days are put together. And remembering that the bus trip would have been one of a whole range of possible situations and exposures that the Public Health Unit would have been looking at. And then, interestingly, when this bus trip was identified, it was by putting that together with the description of a similar bus trip by a case that had already been established. And in particular, there was a long delay in this bus trip, which meant it was a 2.5 hour bus trip, whereas normally it would have been much shorter. And it was that the Public Health Unit put 2 and 2 together and then sought further information from Auckland Transport. So I guess my view is actually it was quite rapid detective work, and the fact that they then were able to get that information from Auckland Transport to help with contacting other potential contacts. And as we've seen, that's already uncovered one further case.
So there was no AT hop card used here? Because apparently with the use of the card, it would be fairly immediately understood what trips had been taken.
Yes, and that was what, by Friday, they were working with Auckland Transport to get the hop card information.
So they
yes.
didn't have that immediately?
They didn't have immediately, obviously. That's not something that the Public Health Unit would have direct access to. They need to talk with whoever it is that, in this case, Auckland Transport, to get the hop card information.
One more bit more speculative question. The rollout of an AT hop card, or like a national a card like that in a national platform, has been speculated for a long time. Now we're in the COVID era, would a card like that be useful, across the country, so that there's a common database of the public transport people have taken,
Well, it could be, but remembering that public transport is just one of the many settings that would be being investigated as part of follow-up and contact tracing. So, there is a range of information sources people can use. They can look through their bank's transactions to look and see where they were at different times quite accurately. There's obviously information from clocking in and out of work, especially using security cards, and even from different settings in workplaces. Lifts has been quite helpful in terms of us trying to get to the bottom of this worker in the MIF facility. So it could be helpful, but I dare say it's a bit beyond my area of expertise to speculate on a national public transport card. Final couple of questions.
Just based on the data, the trends, the case numbers we've seen, do you feel comfortable for Auckland to move out of level 3?
So I've given my advice to Cabinet, and that has, I know, helped to inform their decision, and that's they have met, and the PM will be announcing that at 3.
Are you happy with how Aucklanders have complied with level 3 so far?
Well, I haven't been in Auckland, but what I have seen is some survey work that was done by our All of Government group, and I saw that over the weekend. That showed, first of all, high level of support for the measures being put in place, but also a high level of understanding among Aucklanders and people outside of Auckland about what the expectations were, and a high degree of willingness to sort of cooperate with what those expectations were. So, of course, it's never perfect, but I think if you look at the movement data as well in Auckland, there's been a really good response from Aucklanders, and you can see that as well around the testing. Tens of thousands of tests done in Auckland, which has really helped us get a handle on this outbreak.
Just off the back of that, there were reports over the weekend. There were people, crowding parks, skate parks. Are you worried at all about potential lockdown fatigue going forward if there is going to be continued higher alert levels?
Well, I think this is an issue, isn't it, about people's willingness to, especially if it's repeatedly go into a lockdown situation. We saw high levels of engagement and willingness to do so earlier in the year, especially when it was the whole country. Again, I think the data suggests that there's still a high level of engagement and willingness this time, but it will be an issue if it continues for a long time, or if we have to keep doing it. So saying, as I said, the value of an alert level 3 situation in Auckland has been immense over this last couple of weeks to help us contain any further spread from this outbreak. And also just want to reiterate the value of the whole genome sequencing, something we didn't have earlier in the year, where we would have been puzzled by a number of these cases, and that may have required us to give advice that, even at this point say, actually we might need to go to alert level 4 or extend longer, but the whole genome sequencing has been critical in us understanding whether cases were part of the outbreak rather than novel cases potentially from another source of infection.
There's been discussion over the weekend about a Labour Party campaign ad that featured B-roll footage of you for a matter of seconds, but that ad has since been pulled down, and there's concerns about politicizing the public service. Do you have any sort of comments or thoughts on that? And did the Labour Party ask you before they made the ad whether you'd be willing to appear in it?
Yeah, so actually, well, I'll just say, because I found out about it once it was up, but what did happen was the Prime Minister and Minister wanted to come and visit the Ministry, to visit our incident management team and our contact tracing team, and to be shown the national contact tracing solution. And we facilitated that visit, and there were a number of photos taken and some footage taken throughout that, and I myself took a number of photos for staff members who were thrilled to see the Prime Minister and have the opportunity to explain to her. But I don't have any further comment on the story that arose over the weekend, except that, as you've said, the ad went up, it was commented on, and it's now gone down, or the footage has come down. So that's all I want to say there.
And on the notion of sort of lockdown fatigue, there's been a conception that New Zealand's COVID-19 strategy involves us locking down whenever there is a case of COVID-19 outside of MIQ. Is that the case, or should we be able to deal with small outbreaks at level 2 or even lower levels?
We should. I think you're right. And this was our first case outside of MOQ, and it sort of popped up just through community testing, which is why we need that surveillance testing happening. In this instance, we have needed to move Auckland to alert level 3. I think now that we've got that, we know our testing can ramp up quickly, we know our contact tracing is effective, we've got much wider use of the NZ COVID Tracer app. There is a range of other measures being put in place. The aim would be from here, I should more accurately say, when we do get another case, because again, it's likely to happen again, we should be able to manage it within an alert level 1 or 2 setting, and that is exactly the aim. So yes, we're still on an elimination strategy path, which just means when we do get cases, we want to quickly stamp out any new outbreaks, and the aim would be to be able to do that at no higher than an alert level 2 setting.
And how do you make sure that surveillance testing is ongoing? I mean, you know, in mid-July we had days where there were only 8 community tests across 5 million people.
Yeah, that was a challenge, and I think we've reflected on the fact that there was a number of behaviours, including testing, which as New Zealanders we felt we don't really need to do that. We've got rid of this thing. We all now know that's not the situation. We can and are likely to get further cases in the community, and so we need to make sure we are maintaining that high level of testing, or reasonable level of testing in the community, to make sure that if there are cases out there, as we did in this situation, we identify them early and are able to stamp out any outbreaks. Thanks very much.
Just quickly following on that, did the issue of compliance come into play in your advice today?
No, it didn't. No, we were giving our public health advice based on the pattern of the current epidemic and key public health criteria. Thanks very much.